Alrighty, internet friends, Evan Benton of Dogg for Mayor here, making a follow-up to my recent video on the approval of the Pfizer jab because a lot of people are still insisting that it's under an EUA, or they've pulled some foolishness and it's not actually approved. And there's a second document is what I'm reading on the interwebs, and that second document shows that it's still under an EUA or something like that. I'm not really sure. I'm sorry to report though that it is approved. Okay, and I went into the first video, the difference between the EUA and the actual approval. They changed the name for some silly reason. The EUA covers the old doses, and it also covers children 12 to 15, which don't get COVID. So that's I'm not even going to talk about that. And then it covers the booster shot for people who are immunocompromised, which is another terrible idea. But that's why the EUA exists. So it's covering like some niche circumstances, and I'm sure those will be given full approval faster than they ought to. So it goes without saying that there's some foolishness afoot with this approval, because the trials were not set to conclude until 2023, and here we are 9 months later. So obviously it's just corruption. Okay, if you're trying to figure this out, don't try too hard, because these people are. I made a video about this earlier. These people are chaos cultists. They believe in chaos. They worship chaos. They see chaos as the creative force of the universe. Big Bang Theory, evolution, on and on and on. And if you disagree, you're a conspiracy theorist. That's the terminology. And, long story short, they are insane people. And out of their mouths come insane words, insane sentences. Out of their minds come insane thoughts. And it's not possible to make sense of them. So don't even try. Just try and live your life. And if you're so inclined, join me in the fight and making YouTube videos and putting them out onto the interwebs, trying to wake some folks up. So, without further ado, let's go to the document. Alrighty, here we are at the FDA.gov website. We are under the Emergency Preparedness and Response tab. That is what we are looking at. The Comirnaty, for one, and the Pfizer BioNTech COVID-19 vaccine for 2 products. Okay, so yes, they are under that emergency thingy. They are not under the just regular approval kind of thing, but they are approved. This is just where they're collating all of this information. Okay, so we got all of the documents here, and then down here, media, down here, just translations. So one thing, Comirnaty, the renamed one, has a package insert. Some people have noted that the Pfizer BioNTech COVID-19 vaccine does not. That is true. The Pfizer COVID BioNTech blah 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 does not have a package insert because it's not approved. It's under an EUA. All right, so they don't need a package insert for that. It's just roll the dice, take your chance. Now we're into the approval world, so there's new things going on. We are requiring package inserts. The company does have liability. Okay, so that's the big thing. The big difference is if you get this one, you have no ability, you have no recourse if you're damaged, injured. And if this one, you have, I think, up to $250,000 if your loved one were to die from getting this thing. So if you're concerned about that, make sure Comirnaty is on the label, folks. Okay, so here's the second document, the approval letter for Comirnaty. I'm just going to pull that up here. All right, so it looks okay to me. BLA approval. This means biologics licensing approval. Okay, biologics license application. Excuse me. So they are licensed to produce a biologic, which COVID-19 is not. Okay, mRNA. So, and look, this refers to the COVID-19 vaccine, right? But that's just what this all says please refer to your biologics license application, because that was May 18th, 2020. So this all refers to the older documentation for when it had the old name. So don't get fooled by that kind of stuff. Okay. So we're issuing license number 2229 to BioNTech, which is in Germany, not the United States, for manufacturing in Germany, but that's interesting. And then here we got a lot of redactions. It jumps out at me, obviously, from as soon as I look at this. So we're redacting the locations here where the various components are produced, the various stages of producing the final product. But then down here we're redacting the dating. So that's just I don't get. So the public isn't allowed to know how long it's going to take for this formulation to expire, to no longer be effective. The dating period for your drug substance shall be redacted when stored at redacted. Now, from context, we can read up here and say the dating period for COVID-19 vaccine mRNA shall be 9 months from the date of manufacture when stored between -90 degrees Celsius and -60 degrees Celsius. So obviously that's what it says down here. The period shall be some number of months when stored at some degree. And a big concern I had when I first started reading about this cockamamie mRNA thing is, of course, it needs to be stored at such a low temperature. And how is that going to be maintained at the place where they're injecting people? One of my clients is actually a manager for a nationwide pharmacy chain. Then I asked him what they were doing to maintain that low temperature, and he told me he had no idea. So that's a concern. The way the thing works is it's an emulsion, which is I don't want to get into it now, but it's it's a bunch of basically fat bubbles that the mRNA is embedded in, and what's going to happen if you melt those bubbles, it's going to be just like if you've ever heated margarine up. It's just going to melt and separate. So it's not going to work. Now, just some FDA gobbledygook. But so down here, we're getting into their requirements for post-marketing safety reports. Post-marketing means it's to market. The product is on the market, and we're just following up to make sure it doesn't kill too many people. So, first of all, we've got some pediatric studies. They're deferred, and I honestly don't know what the deferment means. They're saying we need to complete this study, but they're deferred. I'm assuming it has to do with the EUA, as I mentioned in other places. But I want to point out here, so the final protocol was submitted here, or was supposed to be submitted here for the first study. That's children 12 through 15 years of age. So we're doing this under the EUA now. Children 6 months to 12 years of age was supposed to be submitted in February 8th. And then infants, which, God, why, hasn't been submitted yet. That'll be submitted early next year. But look at the final reports on this. So October 31st, 2023, May 31st, 2024, and October 31st, 2024. So yes, it's approved, but we're still waiting to hear back on the final reports of how effective, how safe and effective it is in these groups. So you're very much still rolling the dice if you want to get this into you or into your children's bodies. Here is a required post-marketing study on myocarditis and pericarditis. This will conclude in 2025. This is a similar study in European patients on pericarditis. That'll be concluding in 2024. Another study on myocarditis and pericarditis to conclude in 2024. And another study of myocarditis to conclude May 31st, 2027. And then another one, subclinical myocarditis. So that's where that means that you don't show symptoms. You might have an enlargement of the heart, but it's not, you're not aware of it, and that's going to conclude on May 31st, 2024. And then another one, subclinical myocarditis, concluding sooner than that. So those are just all the studies. Again, we're still collecting data on this, and you are very much a guinea pig. Whether or not it's approved, no matter what stage it is in the process, we are still collecting data on this. So these papers coming out, these government decisions, these politicians making decisions, okay, not scientists. Regulators are not scientists. They are bureaucrats, and that's the world this is in. Okay, that's the world we've been in. As soon as we went to the emergency use authorization route, as soon as we declared a state of emergency, we left the world of science behind. We decided science was too slow, and this is so easy to understand, and it's so frustrating that people don't. But another study on pregnancy. Infant outcomes, so infants who were exposed to the vaccine in the womb, do they develop tumors, is what that word means. That'll be concluded in 2025. And then just immunogenicity and safety of lower dosages, that's interesting, 2024. And then using the VA system, 2023, if that affects you. And then for some reason, Kaiser Permanente Southern California is doing its own little study, and that's concluding 2023. So again, please submit clinical protocols to your IND. That's the IND. That's the serial number for this biologic where it's at right now, and that's what this paper is all about. So that's that. It's crazy. It's confusing, and I don't blame people for trying to keep this hope alive of it's not approved. It's not approved. Yeah, it is approved, but that doesn't change the fact that there's very little science supporting its use. The jury is still out. Just because a government agency tells you it's safe and effective. I mean, we've all seen the memes. Okay, yeah, don't. So I just wanted to make a little video here just to say, that to address that last concern, and just don't get all bent out of shape, people, freedom fighters. Don't get all twisted up trying to figure out this crazy world of bureaucracy and regulations, because it makes no sense. So that's that. My name is Evan Benton. This was Dogg for Mayor, and please keep watching my channel. Please contributing, supporting me in any way you can. Share the video, comment down below, and subscribe. Thank you very much, and have a good day.